Okay, here's another slide. It's called Myocardial Infarction Remote. And like the previous myocardial slides we've seen, the more you zoom in, the more you can appreciate the fact that we have striated muscle, centrally located nuclei, so characteristic of cardiac striated muscle. And these look like fairly viable cells. I wish you could see the striations a little bit as well as I can. But as we zoom out, let's notice one obvious thing, that besides having these viable strips of cardiac muscle, you are also having a lot of scar tissue in which the cells are chiefly fibroblasts, and the pink stuff is no longer cardiac muscle. The pink stuff is fibrous tissue. And the reason why a lot of this myocardium is replaced by these irregular bands of fibrous tissue is because this is a scar. And I think one thing that you can also notice is that this scar tissue tends to choke off or compress some of the cardiac muscle fibers. I think I could convince you in this picture that whereas most of the tissue here are fibroblasts and scar tissue, you could see some remnants perhaps of cardiac muscle fibers which are surrounded by the scar tissue. I would venture to say this is scar tissue and this is a sclerosed or choked off skeletal muscle fiber. And once again, this might look grossly like whitish tissue infiltrating the more brownish muscular tissue. This area is the scar and the browner area is the muscle. So if this is the left ventricle and this is the thinner right ventricle and this is perhaps, it could very well be the anterior wall, you could say this is probably an anterior or anterior septal wall infarct. And once again, these white areas is the fibrosis, and the browner area is the viable or relatively viable myocardium. Thank you very much.